we have to remember that one of the issue is hypovolemia. Therefore, we have to correct the volume status, salt depletion prior to administration of sacubitril valsartan, that is ARNI, or start ARNI at a very low dose. To some extent, I discussed in the earlier consensus point that even we have used ARNI even 50 milligram in split dose to begin with, when there is a fear of the side effect like hypovolemia or even the salt depletion, etc., or even hypotension concern. In hypovolemic patients, we have to see that the diuretic dose is not given in a larger dose. So we have to remember, before starting ARNI, see and optimize the diuretic dose to the minimum what is required. In a fragile patients, elderly patients with the low systolic blood pressure equal to or more than 100 to 120, a lower starting dose of ARNI and a slower up titration should be envisaged, what we do for the ACE inhibitor. So again, my important take home message, when we have a borderline pressure to start with, start a small dose and build up the dose gradually. And this principle holds true for most of the drug in heart failure, like what we are using for ACE inhibitor, ARB, beta blocker, MRA, etc. In patients who are previously on the low dose of ACE inhibitor ARB or who are naive to ACE inhibitor ARB, a lower starting dose and a slow up titration of ARNI are recommended. As with any other disease, modifying treatment that have an additional effect on lowering blood pressure, like ACE inhibitor, ARB, beta blocker, MRA, starting low, going slow should be the standard consideration in the clinical practice, especially in patients who are more prone for hypotension. Similar to the other drugs, maximal dose of ARNI may not always be tolerated by every patient, so we should not be going by what guideline or what trial has shown, particularly in our patient, of going to 200 milligram BD. In our real world practice, we have realized this dose is in very, very few patients we can achieve. Most of the patients are on medium to intermediate dose. Even the lower dose is beneficial than the ACE ARB. We should not be worrying about dose alone.